So we're going to go ahead and get started. My name is Melanie Parker. I'm the founder of the Whole Family Foundation, and we exist to service families who have someone in their family with a disability, and that is a broadly defined disability, not a specific type. Could be any age, could be any demographic, any location, though we are focusing in Virginia since rules change state to state. So this is part 2 of a program on waivers in Virginia waivers and understanding them. Our first one, Lucy Cantrell, who is participating tonight, did a fantastic job explaining all of that. It is on our YouTube channel, which you can access through our website, www.thewholefamilyfoundation.com, or on our Facebook page. And so tonight's video will be recorded as well. And we are going to be talking about who it is that's on the team that helps to implement the waivers. Who do you go to if you need help with your waivers? So we have a great duo that's going to walk us through tonight and go through all of those. So I'm going to turn it over to them and let them introduce themselves.
Good evening, everyone. My name is Renita Clements. I also have a colleague joining me. Her name is Michelle Guswick.
Hi, everybody. It's nice to meet you. Nice to see you.
We are both community resource consultants, also referred to as CRCs, and we work for the Department of Behavioral Health and Developmental Services, which the acronym for that would be DBHDS. Between the both of us, we have well over 50 years of experience working with individuals with disabilities in areas of residential, case management, and now as CRCs. Within the DBHDS, we work in the Office of Provider Development, and we work especially with the DD, Developmental Disabilities Waiver. The sole purpose of our department is to focus on developing and sustaining a qualified community of providers in Virginia so that people who have developmental disabilities and their families have a choice and access to options that meet their needs. A CRC can and should be a resource for families and individuals with developmental disabilities. There's a chart that I believe Melanie's going to put on the screen. So as you'll see on the screen, our department is divided into 3 different teams: individual, provider, and system. The focus of team 1, which is the individual team, is for people with developmental disabilities to live meaningful lives in the community of their choice. The focus of team 2, which is the provider team, is for providers of developmental disabilities waiver services have access to information and technical assistance that supports best practice. The focus of team 3, which is the systems team, is for DBHDS to provide resources for support coordinators and providers that are based on promising and best practices in supporting people with developmental disabilities in Virginia. So for Michelle and I, we both work within team 1, the individual team, and our responsibilities include the regional support team, which the acronym would be RST. And what that is for individuals with developmental disabilities who live in training centers, meet the DD waiver waitlist criteria, or live in a nursing home or an ICF, intermediate care facility. It provides recommendations in solving barriers to the most integrated community setting consistent with an individual's needs and to ensure that informed choice is provided. The next focus area for us is home and community-based settings regulation, also referred to as the HCBS, which was previously known as the final rule. This regulation establishes requirements for qualities of settings where individuals live and receive Medicaid reimbursable HCBS services. The rule supports enhanced quality in HCBS programs, adds protections for individuals receiving services to ensure that they have full access to the benefits of community living and are able to receive services in the most integrated setting. So the deadline for that compliance is March 17th, 2023. And those settings that the HCBS is looking at are going to be the group homes, group day, sponsored residential, supported living, and group supportive employment. Currently, there are on-site reviews that are happening as well as desk reviews to ensure that providers are coming into compliance. The next focus area under our team is mandatory provider remediation. So when we have waiver providers that need remediation as it relates to individuals' health and safety, as well as them not coming into compliance for the HCBS settings regulation, Team 1 will work closely with those providers to ensure that they come into compliance. The next focus area for our team is state hospital moves. So Virginia has several state hospitals across the state, and we work closely with all involved to assist the individual with transitioning back into the community once they are discharge ready from the hospital. The next area is crisis situations. So a crisis situation is defined as a stressful time in an individual's life when they are experiencing a breakdown or disruption in their usual or normal activities or family functions. And we work closely with all involved again to provide resources and to help resolve that situation for that individual. And then lastly, we have constituent concerns that we work with. So we receive calls, emails from political offices, DMAS, as well as individuals and community members. We make necessary contacts or provide information and or resources as requested and necessary to resolve the concern. So within the CRC department, within provider development, we are not so much a service, but a resource to families. And Michelle and I work with individuals under those specific areas. And if I could get Melanie to scroll the slide up some. You can keep going always so we can see the regions at the bottom. So Virginia is broken up into 5 different regions. We have region 1, region 2, region 3, region 4, and region 5. So whichever area your CSB closest to you is located, that's the region that you fall within. And then on the screen, if you could slide up just a little bit, we have a CRC that covers each region. So under the individual team, Todd Kramer would be your contact person for region 1. Michelle Guswick would be your contact person for region 2. Todd Kramer also covers region 3. I cover region 4 and Michelle covers region 5. So if you have any concerns about constituent referral, or you've asked for something from the CSB, you're not getting a response, you're feel free to give us a call and we can do what's necessary to make sure that contact is made and that your questions are answered. Do you guys have any questions for us?
Don't everybody jump at once.
So you're welcome to raise your hand or put a question in the chat if you have any questions or clarifications or anything like that.
So looking at the chart, it doesn't look like there are a lot of things that fall under what we do, but let me tell you, we are busy because crises happen at any time. We can have a to-do list in the morning of what we plan to get accomplished that day, but we all know in the field that we work in, crisis situations happens. And of course, that's going to take precedent over what was on our to-do list. So we are extremely busy, but we take pride in working with families and resolving issues as they arise.
We're also the individuals who you would contact if you just don't really know where to go or what to do or where to go next. You can actually reach out to us and we'll help guide you to the correct CSB, to the correct services. Within our realm, we'll either tell you what services that we know about or we'll connect you to people to help you figure out what services are going on. So we really are a resource there for families, as well as the support coordinators when they're working with individuals who are in crisis.
No questions? Did I do that well of a job explaining?
You did. So you're going to move into the next part, I guess, can we talk about all the different roles? Because I think that was a place of concern and confusion for people, especially who are new to Medicaid or new to the waivers about, what's the difference between my service facilitator and my CCC plus case manager and my, care coordinator, and there's been a name change. I think they're in one of those. So help people figure out who's supposed to be handling what piece of the pie.
So I will say the single point of entry for the DD waiver, which is what we work with, the DD waiver is going to be the Community Services Board. So if you have a young child, the individual has a developmental disability, the first thing you want to do is to contact the Community Services Board in your area and request an intake. During that intake, they'll get background information. They're going to want to see the psychological evaluation. A VISE assessment will be completed. And if they meet 3 areas out of 8 on that VISE, that means that individual meets the criteria to go on to the DD waiver waitlist. There's 3 different criteria to go on. One is the assessment, which is the VISE that I just mentioned. The other one is that they have to be financially, they have to be Medicaid eligible, and then they also have to have the DD diagnosis. So that single point of entry is going to be the Community Services Board, and the support coordinator is the only one that can put in authorization for a waiver, a DD waiver service. There are other waiver services out there. There's the CCC Plus waiver. There's I know there was an AIDS waiver. There are other waivers out there. The one that DBHDS works with, and Michelle and I work with, is going to be the DD waiver. And then you also have your MCOs, and they mostly, if a person does have a waiver, they are the person to go to if there are medical concerns, if you need some type of, I guess, help with getting a script from a doctor, you're having a hard time getting in contact with a doctor, or you need some type of resources, that MCO would be the person to go to for that.
The MCO service coordinator is also your resource when it comes to Epsdt funding, which is early periodic diagnostic and screening funding, which any child under the age of 21 who is eligible for Medicaid in the state of Virginia is actually eligible for this particular funding. It pays for, it has a specific set of services it pays for. I'm not as good with this, but it has skilled nursing, is in assistive technology, personal assistance can be accessed underneath that. So if the child doesn't have waiver, that could be a way to get those services. It could be under the Epsdt funding, and that is something your NCO coordinator helps you with, your service coordinator. The support coordinator, once an individual is receiving case management, whether they're on the waiver or not, should be working with the MCO coordinator to make sure that the individual, regardless of age, is getting all the services that they can possibly get. So they should be working in tandem together. I can say that that is still a work in progress in some areas because it was kind of all new for everybody, but the waiver wait list and the waiver themselves, that's your CSBs or your behavioral health. Then your MCOs, or like Renita said, that becomes your, the medicals helping you coordinate doctor's appointments, coordinate getting, if you need a prescription, if you need a medical letter of necessity for something, those would be your MCO coordinators that can help you get those. Service facilitators are actually individuals who, if you have either set of waivers, whether you're on the CCC Plus waiver or the DD waiver, they're the individuals that actually help you get consumer-directed services. They are the people who come out and do the assessments. They help explain what the employer of records are. They're not the employer of record, but they help explain all the services with the CD services that come there. So they're not a case manager. They're actually a service provider that falls under both of those waivers. They're one of the few providers that fall under both sets of waivers.
Great.
And some of the services, when Michelle mentioned CD, that's consumer directed, where the individual can select who they want to work with them instead of going through an agency. It could be a neighbor, it could be a friend, it could be a family member, if it's an adult. And the EOR helps that individual with the hiring and the firing and making sure that the timesheets are completed and all of that. And the service facilitator is the one that coordinates those services as well. It is a waiver service under the DD waiver as well as the CCC Plus. It could be companion services under the DD waiver. It could be personal care under the DD waiver as well as respite. Under the CCC Plus, it's personal care and respite services.
And just to clarify for someone who's totally new, an MCO is a managed care organization related to your Medicaid insurance. So,
Yes,
you know, Aetna, Anthem, Virginia Premier, Magellan,
yes.
all of that. And I will say, after speaking with a CCC Plus case manager who unfortunately was not able to attend tonight, they were saying it's important to know that there is a contract with DMAS or Medicaid for each of these. And so there are very strict regulations. So you should be getting contacted on a regular basis if, you know, by your CCC Plus case manager to address your concerns and make sure that you're doing well. But she also wanted me to pass on that it's very important that you relay any information that's changed in your demographics. So if your phone number changes, your address changes, if you go in the hospital, anything like that, that she said it's really important to note that that you contact them. I know that professionally I've come across that I've talked to patients and they say, you know, I haven't heard from my case manager, but then we find out who the case manager is and it's documented that the case managers tried to reach out, but the patient, you know, has changed their phone number 3 times and moved twice. And so they can't find them. So, but it's important that you stay in close contact with your CCC Plus case manager and communicate all those needs. And they are the ones also to go to if you want to take advantage, if you have a CCC Plus plan that includes the home modification waiver. So that's $5,000 a year where you can modify something in your home if your bathroom's not accessible, if you need a ramp put on your home or whatever. Something I was not aware of in speaking with her was that she stated that you need to have in-home assistance, paid caregivers in order to qualify for that. That was not something that I was previously aware of. So
there are those waiver services that are also available under the DD waiver that we have environmental when I said assistive tech earlier, that's why I paused, is because I'm with ED, with the CCC Plus waiver, I'm not as familiar. So I do know that they do have the home modifications. What she's telling you basically is it's not standalone. You can't just go ask for a home modification. That's why she's saying you must have an aid in the home. It's the same if you had a DD waiver. That is one of the services that's available. It is $5,000 a year, and it's not a standalone service. You would have to have another waiver service going on in the house. So when she says you must have the aids in there, she's basically saying it can't be a standalone service. So it's not a waiver, it's actually a service under a waiver is what it boils down to.
Thank you for clarifying that for sure. Can you all speak to service facilitators? I know that is something that's more consumer directed, that they can choose who they're going to go through for that. Everything else kind of you get assigned, you know, a case manager through your insurance, and you kind of get assigned somebody through CSV. You don't choose, but the service facilitators, they can choose who they go through. So can you speak a little bit to that process and how somebody should go about
I can go on the DD side. I'm not so familiar with how it works on the CCC Plus side. Once an individual has a DD waiver, then the support coordinator that they would get that comes with the CSB or a contracted agency with the CSB, because it could be one or the other, that support coordinator is responsible for making sure that the individual is given all of the choices of the services that are available to them. And they would be the ones that would say, here are the services. And if you chose to do a CD service, a consumer directed service, then they would explain that a service facilitator would be needed. And I'm going to kind of put an asterisk there because you can have CD services without a service facilitator, but that's a lot of work. But then they will give you the list of the companies that you can choose from. So it's, when we say it's a single point of entry on the DD side, that would be something that the support coordinator / case manager, depending on what that CSB refers to themselves as, that would be their job to make sure that the families got all of the choices, were given choice, and choice was assured. Did I do that correctly, Renita? Anything?
Right. So if the individual has a DD waiver, they have a choice of selecting the group home they want to move to, the day support they want to go to, the in-home provider they want to receive services from. the service facilitator, that they have that choice of choosing a provider. So a service facilitator is a provider, just as a group home provides a service, just as a day support provides a service. A service facilitator is a service provider as well. They're not licensed. It's not a licensed service, but they do have a participation agreement with DMAS.
And there are certain things that they must follow if they are going to be a service facilitator under the DD waiver, as well as there are certain rules they must follow if they're going to be a service facilitator under the CCC Plus rules. So there are things that they must do. They have to see the individuals in certain time frames. They have to write reports and do assessments in certain time frames. And I'm sorry, I am not good enough to remember all of that off the top of my head. I could go look it all up for you, but there are rules that surround that. But it's a service, just like Renita said. It's, just like if you chose to have in-home supports, or if you wanted agency-directed personal assistance, or if you wanted consumer-directed personal assistance, all of that's a service, and so is a service facilitator. So they're not technically case managers.
So this, as I understand, the service facilitator is the one that's making sure that they're getting the right help in the home.
So the service facilitator is the one that goes in and makes the assessment and helps create the plan to assure that the individual is receiving the services or the length of services that they need, the amount of services that they need in the home. So they are responsible for that because that, like I said, it's a service. So they are responsible for making sure a plan is written, what that plan looks like, assessing how many hours the individual may need, and then submitting that to the support coordinator so the support coordinator can send it to service authorization so it can go and be approved. And they're one of the people in the chain.
Right, but the person that monitors all the services that the individual receives is going to be the support coordinator. They are to link, monitor, advocate, and support that individual.
And the support coordinator is through
the Community Services Board. Most of them are called Community Services Board. Some of them are behavioral health authorities or integrated health authorities.
Or they are contracted with those particular CSBs and behavioral health authorities, depending. So there are some support coordination, and this gets a little tricky and complicated for people who are brand new, but at one time we had intellectual disability waivers and developmental disability waivers, and when we merged them all together, those were actually very, very separate and even run. Group was run by Department of Behavioral Health and Developmental Services, and one was run by the Department of Medical Assistance. It all came over to us and we went together. But there used to be DD case managers and ID case managers, and those have all kind of merged. So there is, without getting way complicated, there are some contracted agencies that contract and do case management with the CSB.
Right.
And I know that's a whole lot, but that's kind of how that works. Shannon had her hand up, I saw earlier.
I apologize. I didn't see that. Go ahead, Shannon.
Yeah, so I just, to try and clarify, so kind of if you're on the DD waiver, your support coordinator kind of tells you all your options through that. So when do we pull you guys in if needed?
If your support coordinator is not, I've had a lot of calls where the family member is saying that I've been trying to get in contact with my support coordinator. She's not doing her face-to-face visits, or I've been telling her I need a behavioral specialist and she's not moving on that. If you're asking for a particular service and the CSB will not put forth that service authorization, they should be giving you your appeal right. So if you're having any complications with working with your support coordinator, you can reach out to us. I mean, we'll eventually have to send you back to the CSB, but we can try to run interference, find out what's going on. And if you just are having a conflict where you don't get along, because everybody doesn't get along, we can talk to you and we, speak with the supervisor about, assigning you another support coordinator within that agency. Because people's personalities, sometimes they just don't match.
And then if there was that crisis situation, does a support coordinator still handle that if things are going well with that person? Or is that where you always go above the chain for like families in crisis and things like that also?
Well, if a crisis situation, because sometimes you can just call us when there's a crisis situation. We're going to get in contact with the CSB, find out what's going on. And, sometimes we all need to get on the phone and have a conversation, or we may give some recommendations or resources to the support coordinator to handle the situation.
But we are not your first. If you're in the middle of a crisis at that particular moment, then that's why we have REACH. Then there's Children's REACH. So We don't actually do the physical helping to dissipate the crisis at the time, but we're in the background with the support coordinators there. And a lot of times it has to do with, especially individuals who live in group homes or maybe living in their apartments, and they, you know, are having behaviors, and what do we do? Or we've got to have, this person's got to move right now, where are we going to go? We do a lot of that. We help families in crisis after they've gone through the reach and all of the resources. We help the support coordinators try to think out of the box and come up with services that can help surround the family and the child to help make everything more easy. I'm not going to say better, but easier to navigate at times.
I mean, your first contact should be with the support coordinator to let them know what's going on, to reach out to them for support. But if you're not getting the support that you need, that's when you can come to us, because we are a resource for individuals and their families.
And if I can interject, I believe you told me the support coordinator used to be called something else.
It used to be case manager.
Okay, just to clarify the language for people.
Right.
And
And
manager is not case manager anymore, it's something else.
Well,
and
you'll hear that interchangeably depending.
Right.
We refer to them as support coordinators, but a lot of our individuals who have been around for a very long period of time who are receiving services, we're still going to be their case managers. Renita and I both were support coordinators at one point in life. And I mean, I've been out of that field and at the state for 9 years now, and I will still run into people and they'll be like, look, there's my old case manager. So, you know, it's an interchangeable title, but support coordinators is what we go with. And the reason we do that is because self-advocates said, we are not cases and we don't want to be managed.
Right.
So we took heed with that and started changing that language
Yeah.
many, many years ago.
And actually with the MCOs, the person that helps with the individual is a care coordinator. I don't know if they have case managers there. They have care coordinators there. And then at the CSB level, you know, support coordinator, case manager.
So I'll ask a question then. I'm not seeing hand raising for some reason, so you can pop up in the chat or just unmute yourself after this question. But what would you say to someone who is with a certain organization for service facilitation and they're not happy and they want to change to another organization? What's the best? That may be duplicating Shannon's answer, but a question. But would they do the same thing? Would they contact you, or can they just say you're fired and I'm going over here? How do they do that?
They need to contact their support coordinator and let them know, you know, I'm not happy with, you know, provider ABC. I would like to switch another provider. And that support coordinator should be giving the family either a list or some options to choose from. And
now that's if you're on the DD waiver.
Right, under the DD waiver, yes. If it's the CCC plus, that's not us. We don't oversee that. DBHDS does not oversee that.
So they would need to reach back to their Medicaid.
I'm thinking back to their care coordinator at that point in time.
If
sorry, we're not as 100% with that, but I would start back with the care coordinator and say, this isn't working for us.
Okay. Erica, can you unmute? Go ahead.
Well, yeah, I was gonna say you can. I have CCC plus, and my support coordinator was the one that helped me. I still went through my CSB for all of my CCC plus stuff. I mean, my initial avenue was I had to go to the health department and then social services, and then they got me to CSB, and then CSB came out and we did all of that. And they were the ones that actually provided me with the list of my service facilitator options. So my support coordinator through my CSB would still be the person that I would contact, at least for my district. I don't know if I'm assuming all districts kind of work the same, but that's who I would contact.
Sometimes they all work the same and sometimes not so much. So there are smaller CSBs. I worked for Middle Peninsula and Northern Neck Community Services Board, which is all the way as far east as you can get, just about. It is as far east as you can get. I mean, we include Eastern Shore, so we're about as far east as you can get. We actually opened all cases to case management if the individual had Medicaid, and we could do case management or we had sliding scale fees. I know some of the larger CSBs they actually have what they call follow along. So not everybody has an active case management manager. So it kind of depends, but you're right. If you have a support coordinator, then you would most definitely go to the CSB, even if you have CC plus waiver. If you don't have a support coordinator with the CSB, that's when I'm thinking you have to go back to the care coordinator with the MCO. But if you have the support coordinator, whether your child has waiver or not, if they are just there on what we call SPO, state plan option case management, definitely go to your support coordinator with the CSB/behavioral health first.
And in reality, just from my own experience, as I've been doing this for almost 8 years with my son now, like pretty much your care coordinator, your service facilitator, and your support coordinator, like they pretty much all in a way know all the same information, have the same avenues. If you don't know who the one is, you can ask the other and they'll get you in the right direction. That's just been my experience. They all call and ask you the same questions every month and every year.
I mean,
and you know, it's in retrospect, like I think you were saying, like they do the same jobs, but just in different departments and try to tie it all together in the long run. So if you don't know the one, find the other.
It does. It gets a little complicated when you have a support coordinator with the CSB, and then you have CCC plus waiver also, because there's just different avenues there. So you're right. You have a lot of people that are going to be overseen, and then people oversee them. So there's always a lot of questions. And you'll feel like that you're, having the grand inquisition sometimes, because the service facilitator is going to call and say, how's it going? How's things doing? How's your blah, blah, blah. And then the support coordinator is going to call and say, how's it going? How's things doing? And your care coordinator is going to call and say, how's it going? How's things doing? So you do have a lot of that, but it's a good thing though, because hopefully you, like you said, you can pick up the phone and call one of them and somebody will get you to the right one if they're not in.
Right.
And if all else fails, you guys can call us. I believe, even if you're not in Region 5 or Region 4, anybody can call Renita and I, and we can get you to the right spot. If it's not us, we'll get you to our teammates to get you where you need to be.
Exactly.
Thank you, Erica. Lucy said that she sent Renita and Michelle, she sent you a message on chat. Did you see that? Or I can,
hang on, I'm going.
Or Lucy, I can just show you up if you want. You can ask it yourself.
If they're on the wait list, family leaves the state. Oh, so Lucy wants to know, for families who are in the military with a family member with DD in Virginia, if they're on the wait list and due to military orders, the family leaves the state, what is the status of the family member who is on the wait list in Virginia? And then if the family member is ordered to Virginia and the family member had a waiver, when they come to Virginia, what are their options to get the DD waiver? Do they follow the same path as the non-military families? So let me start with first part. If you are on a wait list in Virginia, you can stay on the wait list in Virginia even if you are out of state. We have had that happen as long as you meet the criteria and you are willing to take services within 30 days if the waiver is offered. So if you are military and you have someone on the wait list and you get transferred out of state and you think that that individual is going to come back and get services, whether the family comes back or not, the individual could come back if they were offered a waiver and could start 30-day services within 30 days, they can stay on the waiver. The second part of that is if a military family, or if any family, military or not, live out of state and the individual has a waiver from another state, those waivers don't transfer, and you would come to the state and you would go on the wait list just like everybody else. Lucy, did we get all of that answered for you?
You did, thank you. I got that question today and I couldn't refresh myself fast enough, so thank you.
And it's not just the military, it's all families are like that. I have family members who live here and maybe they have a sister who's in New York because that's where the parents were and the parents have passed away and they want to move them closer. So they come here and they do the VIDEs and we do all of that and we get them on the wait list and they're on the wait list. So as long as they'll take those services within 30 days.
Okay, thank you.
And Renita's shaking her head yes, so that means I got it right.
You guys are a fantastic duo.
And we've been working together. I've been a CRC for almost 7 years, and we've been together since then, since day one.
Yeah, since day one.
That's fantastic.
He's my twin.
So can you speak a bit more to the relocation piece? If someone knows that they're going to be relocating, is there anything they can do preemptively to start that process, or do you have to be physically in the state before you can start anything? Because it seems like I'm just putting myself in the shoes of a parent with a profoundly disabled child that really relies on those services, or adult child or whatever, and then they're moving and then they're on a wait list with who knows how long till things will come about. So
Yeah, I mean, I would say there is no fast track. You can have a waiver in North Carolina and move to Virginia, and you're going to be on the wait list with all the other individuals. There is no fast track because you are, leaving a waiver and coming to Virginia. I've had families say, I've had a family call me that was in California that will be locating in Richmond, and I encourage them, contact the CSB as soon as possible. Let them know your plans of moving. Make sure, all the necessary paperwork, anything that you can do up front to get that done before you actually move is the best thing to get that going, because not only will you have to have the assessment done, go on the wait list, they also have to have Virginia Medicaid.
And I also, if they have a waiver in another state and feel that they might, or even ask them to please check into the CC Plus waiver for an adult or a child when they come, because sometimes that waiver is easier. The wait list is not as hard to get onto. So it may not be the same services, but it is some services that may help them until which point in time they make it on the wait list and the waiver becomes available, or they have the urgent enough needs. And because our wait list is not it's based on needs. It's a needs-based wait list now.
And I'll just say to families that are on the phone now, your loved one may be receiving CCC Plus waiver. I would encourage you to also make sure that your loved one is, like Michelle said, on the DD waiver wait list. The CCC Plus does have some services, but under the DD waiver, you're gonna have, if it's a community living waiver, day support, residential, in-home, personal care, environmental mod, assistive tech. There's a plethora of services. And I know Lucy went over those services and the different waivers the last time you guys met. So they may be on the CCC Plus waiver now and it's meeting their needs, but think about the future. Are they going to need more supports? And if so, make sure they're getting on that wait list. You're muted, Melanie.
Melanie, you're muted.
Sorry. Thank you so much for everything that you offered. Is there any other questions? You can use the chat.
Sorry, I will be reaching out to you all about starting the process of getting my son on the wait list.
What area do you live in?
I will be in Region 4. I'll fall under Region 4.
Are you already connected to a community services board?
We were with District 19 at one time, but I don't believe we are directly. Kim, no, I don't think we're directly under any community service board right now.
Okay, are you still in that catchment area? You still live in that area?
I'm in Prince George.
Okay.
That would be Renita.
Yeah, I cover that area. And before we get off tonight, if you could put the sheet back up, Melanie, so people can get numbers.
I'll go ahead and do that.
Numbers and email addresses.
And just when you look at that, you'll also see my name on Team 3 in another region. And it's simply because I am filling a vacant spot right this moment, but I will not be there long. So, and that team mainly works with answering administrative questions for support coordinators. A lot of other things they do, but.
So the first column is the column that Michelle and I work in. So Region 1 was going to be Todd. Region 2 is right now Michelle. Region 3 is Todd again. Region 4 is myself. And then Region 5 is Michelle. So we do have a new staff that will be starting. Well, she's already started, but a new staff that will take over her region. She'll be in Region 2 and her name is Nidria Ames. But I mean, if you want to contact me, I am the team lead for the entire team. So if you want to reach out to me because you're not familiar or you don't remember who the person is for the other region, I will gladly get you to the right person, or I can help you myself. It doesn't matter.
Our whole
And
team is-
Lamar,
Oh, go ahead.
sorry, I was gonna say,
I was about to
Lamar,
say-
don't forget that we're in the same area, and I'm on the CCC Plus waiver and I'm on the wait list. So like, go to the experts, let them get you straight. But if you ever have any questions, I'm here to help you out.
Thank you. I'm over here writing the information down now, just looking at the screen, trying to zoom in.
It's not unfortunately, but it is it could be a very daunting, complicated system to navigate sometimes. So we are more than happy to help you navigate through and explain. And please, if you feel like you're asking us the same question 15 times, that's fine. We'll answer it 15 times for you. And
hopefully
that's what
15
it takes.
different ways so you'll understand it.
15 different ways so you'll understand it. Just don't ever feel embarrassed or don't not ask us a question because you're afraid that you've asked us before. We're there to help you, and we'll do whatever we can to make you understand it or to help you understand it and help you get to the right places for your family members.
Right. And in the very beginning, when I mentioned that between the two of us, we have over 50 years of experience, that is true.
That is true.
I've been with the state now. It's going on 7 years this year. I worked at a community services board for 19 years. And I worked at an ICF for 2 years prior to that. So I started when I was 2 years old.
And I started in Medicaid many, many years ago. So I was actually an eligibility worker. Then I went to the CSB, and Renita and I both were support coordinators and support coordinator supervisors at one point in our lives. And I've been at the state now for 9 years, going on 10. This is my 10th year. This October will be my 10th year at the state. So,
Awesome.
so we both started when we were 2. So,
And we have a plethora of experience, knowledge. We don't claim to know everything, but we will tell you if we don't know, we will get the information and get it back to you.
oh yeah, we'll be the first ones to say we have no idea, but we will find it for you.
So again, this will be on, we'll repost this recording on our Facebook page and our YouTube channel so that you guys can reference back. So you can say, what did she say again? And you can go back and you can reference that chart and you can do that. So I'll open up one more time. If anybody has any questions, like I said, you can unmute yourself and ask.
And if you don't want to ask in front of everyone, feel free to email either one of us.
Absolutely. Well, let me just personally thank you both for 5 decades of amazing service. And I'm sure you've made such a positive impact on many, many lives. And we're grateful for folks like you in the trenches with families and the Whole Family Foundation. I know that we're here for the same reason. We want people to have healthy families that thrive. Having a disability in the mix is stressful enough. They don't need all the other stuff too. So healthy families, healthier communities, everybody wins. So anyone else?
Thank you for inviting us tonight.
Absolutely. 100%. Thank you for giving up your evening hours.
No problem.
All right. Well, everyone have a great night. Thank you.
Thank
Thank
you.
you.
Bye.
Bye.